Okay. All right, moving on to our vajayjays on 390. Okay, so this is going to extend from the cervix to the opening of our body. So if you're looking at the slide that has it's labeled vagina, okay, if you're looking at the section that's labeled cervix, okay, remember we have fundus, body, and cervix of that uterus, okay. We, in the olden days, I say, we used to do what's called a supracervical hysterectomy. That means that the doctor would cut this uterus off right above the cervix level, and then we would keep our cervix, and they would just take the uterus part, okay, what was termed the uterus. Well, then there was still a high risk of cervical cancer for females. So then they started like, well, we have to go back and take the cervix out. So we've had females come after surgery so we could just remove their cervix that was left. And supracervical is med term that tells you we're taking it above the cervix, okay? So then they kind of nixed that whole idea for a few years, like we're not going to do supracervicals anymore because what's the purpose of keeping our cervix? There's no point of it. So then the doctors went back to just removing everything. Uterus and cervix, okay? So that cervix section, make sure you look at where it kind of starts and stops, okay? Your cervix is going to meet right where your vagina is, which is the vagina is the opening. So whenever you put someone in lithotomy position and you put a weighted speculum in or a Graves little off-guard speculum, little duckbill, when you look, you're going to see some, like a round piece of tissue with like a little bitty hole in it. That's your cervix. It's a smooth little area, okay? If we have to get into that person's uterus, then we have to dilate that cervix. And that's where your Hagars and your Pratts and all of those dilators come in. So that way, if we need to take a biopsy or if we need to do a D&C, we need to get into that cervix and get into the uterus, okay? So we have to dilate that little hole, the cervix, as big as we have to, for our instruments. So that way we can go in and get the biopsies we need, okay? So your vagina, your cervix, and then it's like your body, and then your fundus of your uterus. It all is going to flow. It's all attached, okay? Your vagina, it says, from the cervix to the opening to the outside of your body, it is posterior to the ureters and the urinary bladder, but it's anterior to the rectum. So, and it says it's just superior to the vaginal orifice is the urethral orifice. So when they're talking about posterior, superior, look at page 391. This is anatomical position when they're describing the location of the vagina. We all know, or if you're not, you know now, we have 3 holes. Your pee, your vagina, your poop. Okay, 3 holes. We don't pee out the vagina, all right? I'm teaching my kids that now so they can know they got 3 holes. And it's okay if you did. We had students already at this point that didn't know they had 3 holes. I mean, they didn't know. So when you're looking at anatomical position, okay, look at where it says urethra, then you have your vagina, then you have your anus at the bottom, okay? So that's why when they're looking, your vagina is posterior to the ureters. So it's underneath it in the bladder, but it's anterior to the rectum, So it's in the middle. So that way when you look from a side view, you'll see it's your rectum, your uterus, and your bladder. So directional terms are really important, especially when you're going to take your CST exam, to make sure you understand. But remember, anatomical position, okay? Your person standing up, so if you're looking straight on, you're going to have a bladder, a uterus, and then the rectum. Okay, so it's anterior to the rectum, posterior to the bladder. Even when they lay down, you can still tell it's in the middle. Urethra's on top, the rectum, the anus is on the bottom, okay? So make sure you understand your directional terms. It says, in the area in which the vagina and the cervix meet are some recesses called fornices. So not really a whole lot of reasoning for these things. But if you look at your vagina slide, right here, they have little curves, okay? And if you look, it says lateral vaginal fornix. So where your cervix kind of pokes into the vagina, there's two little areas right here, okay, that fit. That's your fornices. Okay, you have right and left. If you hear the doctor talk about putting a retractor in, and we have what's called like a roomy retractor, and it has a cup on it, which is just a blue ring, it fits into the lateral fornices of the vagina, okay? And until we really knew what those little side pieces were called, we didn't know what the hell they were talking about with the blue ring. We just knew the cup went and fit around the cervix. And the rep was like, it goes into the lateral fornix. I'm like, what is the lateral fornix? Like, what are we talking about? And so then when he pulled up the picture, I was like, oh, so they have a purpose? Maybe just a whole cup? I'm like, I don't know. So that's what those little indentions on the side are. Okay, it's like an area. That's it. But you'll learn when we put in a retractor, a cup sits perfectly in that area around the cervix, okay, as a little handheld retractor. All right, so 3 functions: coitus, menstruation, and birth. Coitus is sex, of course. Your period flows out through there. Your baby comes out of there, okay? Other than that, is just whatever. It's a very thin wall, your vagina. It's not thick, okay? So that's why it can kind of tear easily, especially during childbirth, okay? Or if you're having any kind of procedures done there, we have to be careful because any little nick, we have to sew it up, all right? You just usually take like some Chromic, some that'll absorb and kind of go away. In like 7 to 10 days, fix it, you're good. You shouldn't have anything to where you have to go back and get your stitches taken out. Okay, when you're doing something like a mucosal lining, you do like plain or Chromic, so that way it'll absorb, okay? So not really much to learn about that. You're not gonna have to do the layers of the vagina, that's it. So we're highlighting what's on this slide right here, okay, where it extends from. The 1, 2, 3 is just basically the 3 functions of it. Know your location, and then know the fornix area. Okay. Let's see what's after this. All right, so that was it for internal organs. Very plain and simple. Uterus, tubes, ovaries, your ligament, and of course your cervix will go and meet into your vagina, okay? I think the trickiest thing is really just if you're looking at your photo when you're reading and studying, it's gonna help you put it all together. Because it's really just kind of know where everything is on this one photo, know where your tubes are, and just kind of label your ligament, okay? Your broad ligament's that big leaf, your suspensory ligament, your uterine ovarian ligament, your round ligament, and your coronals at the bottom where your broad tapers off, okay? So it's really not that hard. There's not a lot down there, and I think being a female, it's a little easier for us to understand. It's just you don't know all about your ligaments just yet. You're learning about all of this stuff now. You have tubes, ovaries, and uterus and things like that, okay? But now it's just kind of putting it together surgically for, we have ligaments that are attaching and holding all of this stuff into place. Now, when we do surgery, we have to clamp, ligate, divide, all of that. Because remember, we're all getting blood supply. We have to ligate and divide all the blood supply and the nerves, okay? So that was it for the internal ones, okay? Go invisible body, make sure that you're looking at the blue sections because that's where your diagrams are going to come from for the test, okay? I'm going to check it. I'm glad you said that. I need to see if they're published, okay? I'm